varmt välkomna igen till Studio e-hälsa med ytterligare en livepodd-inspelning. Och den här kommer vara på engelska och den handlar om hur Belgien kvalitetssäkrar e-hälsoappar. So we're going to do this in English. So very warm welcome to Etienne Maerien and Vincent Dupont. Welcome.
Thank you.
Thank you.
So welcome to 2025 podcast. We're doing sort of international outlook, and we are very, very pleased that you had the opportunity to come here as a guest and talk about the Belgium's commitment to the quality assurance of health app. You call it, as I understood, like Mobile Health Belgium. But start first, Vincent Etienne, could you please tell us what is your role within this program of Mobile Health Belgium?
Well, I'm the e-health advisor for the Federal Minister of Health, and we had an action plan with 20 actions, and one of these actions was Action 19, and that was around piloting mobile health applications in our ecosystem.
Yeah, and my role, Vincent Dupont, I am in charge of the National Health Portal, which is embracing the eHealth technology. And in that role, I'm reporting to Etienne, which is the e-health advisor. And of course, today what brings us together is inspire and be inspired. And I think therefore it's good that we have those chances to exchange good practices together.
So before we move on, could you explain what does it mean in your terms, what is a mobile health?
Etienne?
Well, mobile health is not about only mobile phones or something like that. Mobile health it's about distance, so that the patient does not need to be present with the physician, and the distance can be a few kilometers or a few hundred kilometers. In Belgium it's a few kilometers, but you don't have to do this going to your physician, and you can be monitored constantly. That's our definition of mobile.
It's not the face-to-face, but more, let's say, remote kind of connections, Internet of Things. So it's not really a mobile application, but really looking how do you do kind of connections that are, let's say, not face-to-face, which is important, I think, which is the future. So you have to be prepared for the future.
Okay. The focus on quality assurance of health apps is a governmental initiative.
Yeah.
Why does the government think this is an urgent issue?
Well, we think that Dr. Google should not become the standard. There are hundreds of thousands of apps on the market, and we are not sure that they're all working correctly. That's why the government wants to have a validation approach to make sure that the apps do what they say that they do, and that they are safe, because patient security, patient safety is very important. And so we don't want that it goes to the market and that our providers start prescribing things that I find somewhere in the Apple Store or the Google Store.
Yeah, and at the end it's about trust. I think trust, and every single European country should emphasize the possibilities for their citizens to use eHealth applications in health.
Okay. The initiative means that the supplier can register their mobile health application via a platform that is called eHealth Belgium. If the app meets the number of requirements, it's published on the platform and can be downloaded. Who are the main users of this platform? Is it the patient or the healthcare giver or someone else?
Well, it's both. Of course, the patient, because the patient will register a lot of things physically or automatically, depends on the app, of course. And then there is a kind of backend where all this data is processed with algorithms, with smart artificial intelligence, and it is the care provider or the nurses that will monitor, will see when there are some changes in the situation of the patient or some alerts, and then they have to take the action. Yeah. So the mobile app on sich is with the patient, but the back end is with the care provider.
Yeah, and I would add to that, of course, it's the care provider that prescribes at certain moment where there is usage of an eHealth application, because I think that's the important message and link you need to make for making it happen.
So what kind of apps is it? What kind of products is it on the platform? Is it something that's used for chronic disease, or is it for health or
I would say it's a variety, and I think we open the discussion also not only for local ones that have been developed in our country, Belgium, but also to look to which one does exist in Sweden, which one does exist in the Nordics, and I think in the ones that we have today, we see many interesting chronic diseases in that area.
Yeah, it's more for cure and care, for real medical practice, not Fitbits or things like that. That is not what we want to include in our validation pyramid. It has a medical usage. That's important.
And the health apps, to qualify to be in your platform, the health apps must be validated, and you using like a validation model, then you described it like a pyramid.
Yeah.
Where level 1 is on the base, where the basic criteria is that the app must be CE marked as a medical product or medical device. What is the requirements of level 2 and 3?
Well, first, level 1 is CE mark, and CE mark 1 is enough. That's just saying that this is a medical platform without algorithms or something. CE2 is higher, algorithms, machine learning and things like that. Level 2 of our validation pyramid is about making sure that the app is connected to our eHealth ecosystem, so that they respect the informed consent, that they respect the therapeutic relationship, that if they communicate with the rest of the ecosystem, that is in a secure way, and we have there an infrastructure for that. So we want them to connect to this infrastructure so that everything is based on a secure, encryption-based and all these things way. And level 3 is about, once you have reached level 1 and level 2, and there is enough clinical evidence, you can also go for a health economics proof, say this helps the cost decrease, and then you can go to level 3 and post a report that goes to an expert team that then decide whether this is really good enough or not good enough.
So does it mean that the healthcare giver can prescribe these kinds of apps after it's been on the level 3?
So they can already prescribe when they are level 1.
Yeah. Okay.
So that's our goal, that the care providers look into this validation pyramid. If they say, yeah, we can use medication, but perhaps we can also use something else, a digital app, that they don't go and search in Google Store or whatever, but that they go to our validation pyramid and say, this is about diabetes. Perhaps we can use this or this system to monitor better, that they look in this validation pyramid to select the right application and not think about, let's go to Google and perhaps there is something that is useful for you. And when it's prescribed or advised, then you can, it's possible that there's a kind of reimbursement will be there.
All right.
So it needs to be prescribed.
So why should I, if I were a supplier, apply and sort of go through with my product to this validation process? What's in it for me?
Well, we're going to explain to our care providers that when they want to prescribe a digital solution, that they have to look in this validation pyramid. So it's good to be present in that validation pyramid. If you're not present there, perhaps the care providers don't know you anymore.
All right.
That's the idea.
And I would add to that, of course, it's important that we as a country, we define the rules of engagement very clearly, and we filter the kind of applications that we know that's going to be good for a citizen, because let's be honest, it's very difficult today in the more than 100,000 health apps that exist to really try to help, because at the end you need to give that kind of extra a guarantee to your citizens and patients that they are in good hands and they get prescribed apps, eHealth apps that really help them to get better care.
Okay. So what is the reaction among the vendors? How do they feel about this? Are they
I think they are really happy, because I think first of all what we wanted to share is that it's good that we can share this through Vitalis, that is the biggest Nordic event, and that I think it's important that we share that information with our neighbor countries, because at the end I think we need not to reinvent the wheel. We need to make sure that we use the basics that exist and we try to make something affordable which needs with the right steps, because I think at a certain moment you need to make sure that you have enough grip in the market where you attract suppliers, local or international, and I think for us it's really opening a market and adapting and allowing those new suppliers to be present in the market.
So what is the biggest challenge that you still face?
The biggest challenge is that our care providers will look into this validation pyramid and start seeing that there is something else than medication. Yeah? And of course we want to make sure that this validation pyramid is included in their practice management systems. So therefore it's a portal so that you can easily open it and look for a suitable application. But this is brand new, so we have to educate and make sure that they are getting enthusiastic about this possibility. Yeah. But that will be the biggest challenge, I think.
And I think we can also add that, of course, it's a call to action, because honestly today we have a short list, but anyhow we would much love to have much more applications that would be submitted, because at the end I think we're happy with the ones we have, but we expect to have much more in the coming weeks and months.
Oh well, good luck, and so interesting, because I think for us it's also an issue how we're going to validate the new technology and the new application that come. So thank you so much.
Thank you very much,
thank
Carina.
You, and good luck.
Thank you.
Thank you, Etienne Maerien. Thank you, Vincent Dupont. And thank you, Carina McNeil, for this interesting talk. We're going to move on and going to do it in Swedish as well. Studio e-hälsa vilar aldrig, höll jag på att säga, men dagen må gå mot sitt slut, men vi har en programpunkt kvar för idag, 4:30. Då kommer vi att panelsamtal med deltagare från SKL, från Inera och Socialstyrelsen, som kommer att handla om hur man sjukskriver rätt vid rehabilitering och sjukskrivning. Missa inte det, vi är tillbaka 4:30.